Good morning, and thank you everyone for attending another COVID-19 update in the city of Gary. As you all know, we continually closely monitor our COVID-19 update and our numbers with an effort to give you the latest information on infections and COVID-19 related deaths here in the city of Gary. Unfortunately, today I have to report that the numbers continue to rise, but the other side of that is that we anticipated that that would be the case for a number of reasons. We feel that this is due in part to increased testing, as well as people sort of becoming relaxed in their comings and goings, and certainly there have been instances where people are certainly not practicing safe social distancing. And so until we are 100% certain that we are clear and that things are okay for us to resume our normal courses of life, we're going to continue to encourage you to practice social distancing. Everyone, if you have it and you're going to be in the company or close company of friends or family members that you don't normally see on an ordinary basis, you certainly should consider, and we're going to say encourage you to wear masks to help prevent the spread of the COVID-19 disease. We must remain focused on fighting this virus. Earlier this week, we announced guidelines for businesses, houses of worship, and community venues, and today I'm going to share the latest updates. As you know, all through the process, we followed the state guidelines of Indiana Governor Eric Holcomb, and to that extent, we have continued to have our restrictions extend a little bit further beyond that of the governor. So briefly, here we are. Businesses and retail stores and other stores that have customer traffic can now open up to 75% capacity, or occupancy, if you will. Restaurants and bars with food service can open up to 50% capacity, but strictly bars and nightclubs must remain closed, and that also goes for similar entertainment venues. They must remain closed, and Dr. Walker's here as well. I'm certain he may share a little bit more information, but if I'm not mistaken, that date in which they will be allowed to reopen with restrictions would be June the 14th. But as usual, we'll certainly put the most recent and accurate information on the gary.gov website, so please visit that to be abreast of the latest information. In terms of houses of worship can hold in-person services, but they should not have more than 100 people at a time, and individuals and families should be spaced 6 feet apart. You will, as I suggested, find more details relative to that on our gary.gov website. I'd like to briefly talk about the testing. City of Gary Health Department is presently providing free testing to Gary residents. No doctor's note is necessary, and there is no upfront payment, but visitors should bring proof of insurance if available. And lastly, the health department is located at 1145 West 5th Avenue, and they'll be open for COVID-19 testing Monday through Friday from the hours of 9 a.m. and noon. Along with myself and Dr. Walker today, we've invited Dr. Vanessa Allen McLeod back from the Gary Urban League of Northwest Indiana, that is, rather. She's going to continue to make that impassioned plea for all of us to participate in the census. And as I suggested in our last update, we have the fortunate luxury of having the deadline extended until October. So there is a real genuine opportunity for everyone to get it filled out. She's here to tell you about some creative ways to do it and how you can assist in helping us get our numbers up. Please remember that for every person counted, it translates into dollars into our city of Gary in order to provide some of the services that you have come to know or are expected to receive in the city. Without further delay, I'm going to bring up Dr. Walker to share the latest statistics with you. Thank you.
Thank you, Mayor. Certainly a privilege to stand before the citizens of Gary today. Thank you so much for the opportunity. Also, of course, we want to recognize Dr. Alan McLeod, who's going to speak to us about the census and the importance of the census, of course, because if they don't know we're here, we're not counted, we don't get the resources that are necessary to battle things like COVID. So we're going to share first the state numbers with you. In the state of Indiana, as of yesterday, reported 430 new cases in the state of Indiana and 23 new deaths. So that brings our total of cases in the state of Indiana over 38,000 now. So 38,033 positive cases of COVID in the state of Indiana. And unfortunately, we've seen now 2,158 deaths. Also in Lake County, what we've seen now is 4,033 cases and 219 deaths in Lake County. In the city of Gary now, yesterday we had 6 new cases, and I'm going to go back to the number in a second so we can kind of look at that. So that brings now we have a total of 720 cases, positive cases in the city of Gary, and unfortunately there has been 51 deaths. So I want you to keep looking at that number of new cases as you see it fluctuate over 10, below 10, over 10. And as we reviewed our numbers with our statistician, Mr. Martin Brown, we've determined that number of 10 is a really convenient number. It kind of sets forth the number that we can look at in terms of the trends of increase and then start a decrease in the nation as a whole. So if you take our numbers in Gary and parallel them with the nation, we really want to see a consistent less than 10 on a consistent basis as we start relaxing some of our restrictions. And what we've seen still is a bounce back and forth between the lower number like today of 6 and then a bounce into the mid-teens and back and forth. So we're looking to see something consistent under 10 consistently for a couple of weeks. We have seen a slight decrease in Gary in the overall numbers in terms of that bounce back and forth. But we do anticipate now that we've seen the warmer weather and people getting out, of course, the very justified protests that we've had in the city, we expect to see a little bit of an increase again as people have congregated together in areas, some not wearing masks. So I want to stress again that these things do a lot to prevent the spread, these masks. Social distancing as we gather is extremely important. Want to stress again, there is no vaccine for COVID-19. I was watching Dr. Fauci speak today. He is optimistic that there's a possibility at the beginning of next year we'll have a vaccine, and that would be a very, very ambitious goal. So what we have been doing is what we need to continue to do to protect ourselves. As far as testing, we continue at the Gary Health Department, as the mayor has stated. Currently now, there is no doctor's note, doctor's order necessary to get testing at the Gary Health Department. Methodist Hospital at the North Lake and South Lake campus is providing testing. Again, if you're symptomatic, no doctor's order is necessary. And we're appreciative to Edgewater Health as they have reached out to us and said they plan on providing testing going forward. And it's greatly appreciated because as they're going to go forth with tests, we can then direct people properly as to where to get results. So thank you to Edgewater for giving us that information. Also, we want to talk about what does it mean to be COVID positive. As I stated last time, there's a lot of what we call morbidity that is related to being COVID positive. So you've heard those numbers now. It is 120,000 people we know that have had mortality with COVID-19. But what about the morbidity? What about the people that now have chronic lung disease, people that have had strokes, people that have had amputations, people that have chronic liver disease, chronic kidney disease, and some things that we don't even know about yet. And we really don't know those numbers, so those are the type of things now that we need to concentrate on so that we can get these walking wounded back into society. Also understand that the CDC is quite clear in their guidelines that once somebody becomes asymptomatic after being positive and has the appropriate quarantine, they are now not infectious and allowed to return out to the workplace and to social gatherings without risk to the public. I bring that up because there will be some people that will continue to test positive even though they have been quarantined, and the research has shown that even though they may have continued, based on the type of test that we have, they may continue to test positive, but they are not infectious at this point. You also may have seen the recent article in which the World Health Organization had a disagreement with the CDC in terms of, are there people who are asymptomatic and their spread to others, was that rare or not? And that brought forth a greater point in the article. People were confusing asymptomatic, never showing symptoms, to pre-symptomatic. Pre-symptomatic means not showing symptoms and then showing symptoms later. And we do know for certain that people who are pre-symptomatic, that they are highly infectious and that they can spread disease to others even before having symptoms. And so I wanted to just point that out, that it is different from being asymptomatic and being pre-symptomatic. So it does make sense that asymptomatic people probably have less chance of spreading disease simply because they're not coughing and sneezing as much, less mucus, but we do not know that they, as the World Health Organization has suggested, we do not know the amount of infectivity, just we know that it's less. Also, in terms of our restrictions in the city of Gary, we are looking to start opening up more capacity at restaurants and at bars. And so for bars now in the city of Gary, they will be able to reopen at reduced capacity on June 21st. So that'll be a week after other areas in the state, as Lake County and as Gary has continued to stagger what other areas have done. And I want to again say how appreciative I have been of the team in Gary who has supported me in my work in trying to maintain good health in the city of Gary. Very appreciative to our mayor, and very appreciative to Dr. Alan McLeod, because what she's about to talk about next is the census. And as we are counted, that is how I'm able to gain resources to provide the best health to our population. So please fill out your census cards. Thank you.
Greetings to the listening audience. Thank you, Mayor Prince, for the opportunity to present to you today. Now, the mayor has come up and talked about the census and how important it is. Dr. Walker has come up and said this helps him in his funding that comes to the community. And many of you have already been in receipt of several food baskets from the city of Gary has given out food, and you've rushed down to get that. Faith leaders and the community partnerships have given out food over on 6th and Carolina, wherever they're in Progressive Church, and we've run down to get those free items. The Urban League has passed out. Well, the only way that we're getting this is because of the count. People are depending on us to respond to the census so that when we seek grants and when we ask for money, we can say, hey, our people, we don't want to hand out, we want to hand up. And the way we do that is by responding to the census. Now, I know you lost that envelope that came in the mail. I know you can't find it. It's under the magazine. It's on the floor. The dog got it. Or you just threw it out and said, I'm not dealing with this right now. I'm dealing with COVID. But while you're at home, please, please respond. And this is how you can do it. Now, let me hold up this fan. We're going to pass out some fans Saturday. It says, United States, the Census 2020. You can go online and respond by going to www.mycensus2020.gov. mycensus2020.gov. Did I say that right? If I didn't, you just call my office at 887-9621. Another way you can respond is just pick up your phone, your cell phone, and dial this number, 1-844-330-2020. That's 844-330-2020. Now, I don't want to come before you every week saying this and you're not doing nothing. You know, it's like that song that James Brown, saying nothing and talking loud and saying, some of you remember that? We need you to act. We need you to do this right now. Our numbers are at 45% response rate. The national number is at 50 or 55%, so we're a little bit behind. So please stop and do what we need you to do, which will help all of us. Now, I'm not the only person that chairs, or should I say serves in this capacity. The committee, the Gary Census Count Committee, is made up of many people from the mayor's administration, from healthcare, from civic organizations. Everybody has jumped in to fight this cause. In fact, I just asked the mayor this morning for some money for a sign. Now, he said he was going to find it. Hopefully, he'll find a little bit of money, because we want a sign up to remind you as you're driving down the street and you see that census. We want you to say, there's that sign again, there's that sign again, have I done my census? Well, in our committee, we have several subcommittees. Last week, we came up and we showed you all of those wonderful posters that those children made. We received money from the Legacy Foundation to present those monetary gift cards to them, $800 for high school student, $200 for middle school student, on and on. We received money from Legacy to do that. We have other subcommittees in our group, and the one that I want to bring before you now is the faith-based committee. That's the faith-based subcommittee of the big committee. Those subcommittee persons are Prophetess Burgess Peoples and Kathy Malone. Both of those chair that meeting. So I want to invite Prophetess Burgess Peoples up, but before I do that, you see these babies? Do you see these babies? We need your help for our future. Turn in your census, call the number, get on the website, do it now, do it now. And if you forget the number, just call the Urban League. Thank you so much. Here's a fan. Come down and get one. Thank you.
Good afternoon, everyone. Thank you, Mayor Jerome Prince, Dr. Roland Walker, and Dr. Vanessa Allen McLeod. You guys are amazing, and the work that we're all doing right now is going to benefit the future and our present citizens here in the city of Gary. Now, the faith community, there is this thing that we do during service, and they have the officer come up, and he said, this is the part of the service where everybody can take part. Normally, that's tithes and offering. Today, I'm saying for the faith community, all of us can take part in filling out our census forms and getting them back expeditiously. So far, the faith community has been doing an amazing job coming up with creative ways to get the word out about census to their congregants and also to the citizens and of the communities that they serve. So they've been having drive-up services, drive-up for prayer, and during these times, they give out census cards and information, just like this one, and I don't want you to just throw these in the back of your car or just drop them off in your house. We really need you to take action and utilize this information so you can be counted. As Dr. Rowland and Dr. Vanessa Allen spoke earlier, that your count help us get the funding that we need to support the services that we want to offer you. It helps with our educational systems, hospitals, emergency workers, our roles, and especially with our schools. So we don't want to lose funding by not filling it out. We want to gain and have more funding come in. So in order to do that, we all need you guys to take part. So pastors, faith leaders, all throughout the city of Gary, thank you so much for getting your congregants involved, but more importantly, this Sunday, if you could, and every Tuesday when you have your platforms on social media, talk about the census, getting not just your members to fill out their forms, but the citizens in a whole. So again, they can go online to 2020census.gov, or you can call the phone number, which is probably on the screen right now that you can look and you can dial. So I'm sorry, it's 844-3030-2020. So if you have any questions, do call the Urban League. They can definitely assist you and get information out to you. If you have an event coming up, the faith community have hosted several food giveaways throughout the city of Gary, and at each one, we're giving information in regards to the census. Now that the doors are opening up the church again, you can have almost 100 members there. Get that 100 members right in service to pull out their phones and fill out the census. It only takes less than 6 minutes. So it's not going to take a whole lot of time away from service for you to get them to do this. And if you're still doing outdoor service, by God, have them pull out their phones and fill it out. I think it's the cutest thing ever to post online that your members are doing this online so they can share with their families and other individuals can get involved in filling out their census forms. So if you don't think it's important, watch how the funding from the federal government fall if you do not. We want this funding because we need it. So thank you, and I can't wait to see you guys fill this out and post it online that you've done it. Take care.
So thank you to Dr. Walker, Dr. Allen McLeod, and certainly our last speaker, Prophetess Burgess Peoples. In my introduction of who is attending today, I omitted to say her name, certainly by mistake. Burgess wears a number of hats in the community, and one of which is she's been designated the official organizer of faith-based initiatives that are related to the city. And to that extent, as Dr. McLeod pointed out, the census initiative takes effort from everyone. It's certainly the city administration, it's the Urban League, it's the NAACP, but it's certainly the faith-based community also. And to that extent, we thank Prophetess Burgess People for her work as well. In closing, just have a couple more comments. Now that the weather is warm, we certainly know that people are going to be out and about. Unfortunately or fortunately, it depends on what side of the coin you lie on, but without question, we'll have a number of visitors coming from Illinois also. And so with that, it just warrants us to be a little bit more prudent about our own activity and our own desires and abilities to stay safe, and that certainly includes practicing safe social distancing, and as you've seen displayed by everyone who's come here today, certainly wearing a mask contributes to that as well. We just have to be more alert and continue to protect ourselves and our neighbors as well. So, having said that, I'd ask one more request of you, and that is, as usual, anyone that you know who doesn't have access to cable channel or doesn't receive the updates, please share that information with them. Please encourage them to call City Hall or the Urban League or anywhere that they possibly can to get the information. But you also can help by sharing this information with everyone who you're in contact with. And lastly, as I always end, I want us to continue to be safe. I want us to absolutely continue to be responsible, but most of all, I want us to know that as we've started at the very beginning or the onset of this, and as we've certainly proven up to this point, that we can and will get through this together. Thank you.